I'm joined now by Dr. David Lieberman, past ASGE president, talking about ASGE's session on colonoscopy. What's new? What should physicians be doing at this point?
Well, colonoscopy has really become a centerpiece for GI practitioners. So we do a lot of colonoscopy with the goals of preventing colon cancer and reducing colon cancer death. That's the primary reasons that we're performing these examinations. And the good news part of the story is that there's been a significant drop in colon cancer mortality in the United States. If you look at 2000 to 2010, there was a 30% drop in colon cancer death rates, which is fantastic. I mean, it's terrific news, and some of that was related to screening and colonoscopy performance. And then the other piece of this is that there's been a significant decline in the incidence of colon cancer. So in other words, we're preventing cancer. And we believe that colonoscopy may be effective for that because if we're detecting precancerous polyps, adenomas, and removing them, that we can prevent many cancers. And we have evidence that we're doing that pretty effectively.
Compliance for colonoscopy, I know, is a real challenge in getting patients to actually get their screening. Do you have advice for physicians on how to empower their patients to get the screening and possibly prevent colon cancer?
So that's a great question. I think that we've learned that the messaging, it's important for healthcare providers to talk to their patients about getting screened, that there are several studies that have shown that when healthcare providers, primary care providers, talk to their patients, that the screening rates go up. The goal right now for the National Colorectal Cancer Roundtable which is a group of many organizations, including ASGE and AGA, is to try to achieve an 80% screening rate by 2018. So it's one of these big, audacious goals, but I think it's attainable, and we're up to about 65% of the public getting screened right now.
It's a lofty goal, but it's an important one, certainly. Can you talk to me a little bit about improving the quality of colonoscopy? Because there is some troubling news, even out of this meeting here, that there are limited number, but patients who are getting diagnosed with cancer after their colonoscopy.
Yes, so we're doing a lot of colonoscopy now, and I think that appropriately we're asking important questions about, are we doing it well? And we know that there are some patients that develop what we call interval cancers, in which the cancer is discovered at some point before the next scheduled examination. And of course, patients expect if they're going to get a colonoscopy that they're not going to get colon cancer. So this does happen, and it means that our exams are not 100% perfect. And there are several reasons for it. One could be biology, that there are some tumors that grow quickly. But the other reasons are related to quality of the examination. If we're finding polyps, making sure that we remove them completely, and there's a new emphasis on this, and then making sure that we don't miss important lesions in the colon. So that means spending the time that we need to spend looking carefully at the lining of the colon to make certain that we identify important lesions. And there's a group of lesions that we may be missing more commonly that are called sessile serrated polyps. And these are very flat, very subtle polyps that are in the proximal part of the colon. They're hard to see, and so special effort needs to be taken to look at this. That said, we have, fortunately, very unusual instances of these so-called interval cancers. Some of them are just related to getting patients back for follow-up exams at the right interval. And so that's an administrative and communication issue, and that's what I consider the lowest hanging fruit, that if we can make certain that when we complete our colonoscopy, we give the patient and we give the primary care provider recommendations based on evidence-based guidelines for when they should be back, we might be able to reduce that rate of interval cancer significantly.
That's critical information. That knowledge is power. Thank you so much, Doctor.
Okay, thank you.